Hello everyone, I am Professor Ruth Page and working with the National Literacy Trust, we are offering this webinar to help support you as teachers, colleagues, wellbeing support teams as we navigate the demands of teaching media literacy in the context of the complex mental health needs that our students experience. We're so grateful for your commitment to the young people that you work with and for your time here today. So in today's session, we're going to cover three things. Firstly, we're going to look at what mental health literacy is and how it connects to the media literacy that young people need. Then I'm going to cover a free resource that will be available from earlier next year to help you develop critical conversations in the classroom about this topic. And then lastly, I'm going to give you some recommendations for staying up to date with this fast-changing context. As you'll see from this opening slide here, later on in the talk, in slide 7, there's a quote that I've included that mentions eating disorders. So do feel free to step away at that point if you need to do so. And just as a reminder that because of time, we're not holding an open Q&A in today's session, but if you've got questions as we go through, please do pop them into the chat. And the team from the National Literacy Trust are going to gather them together and we'll respond to you after the event. So the work that I'm going to share with you today comes from the research and evidence we've gathered in a 2-year youth-led project that's called Influencers Stories of Mental Health and Young People. This is a project that spans from linguistics and psychology and public health. I really want to acknowledge that what I'm presenting to you today is a team effort, and it's also from the colleagues that you see here on the screen, and most importantly from young people who are part of our advisory group on the project. So in our project, we've explored thousands of TikTok videos and we've listened to lots of young people in 18 focus groups with schools and colleges. We've also listened to experts, mental health professionals and experts by lived experience. And throughout the research, we've really tried to keep young people's perspectives and their voices at the heart of the project. And it's young people's needs that mean that we should understand mental health literacy. Many of us are aware that social media is often being used by young people for what they term DIY mental health support. The report by STEM4 in 2023 actually found that this was as many as 1 in 3. And we know that young people are not alone in this. Having talked to NHS professionals, we know that the issue is much wider. There are many people of different ages who encounter a great deal of misinformation about mental health in our day-to-day lives. So then, what do we need to know? Firstly, we need to understand mental health literacy. So mental health literacy is the term used in research to talk about the factors that people need to make informed decisions about their own well-being and to support others in their communities. And it includes the ability to recognise mental health conditions and issues, such as symptoms and particular kinds of disorders. It includes knowing how, when and where to seek help, either from professionals or informally. It also includes basic knowledge of activities that promote mental well-being, such as healthy eating, sleep, stress management and appropriate physical activity. And it includes promoting positive attitudes towards mental health care. It's typically covered in the PSHE curriculum theme Wellbeing for Life, although media literacy is typically part of core theme 3, Living in the Wider World. And we really need to bring these two things together, both mental health literacy and media literacy. Critical thinking is at the heart of media literacy, and we need to bring this to bear firstly on the information that's given in social media about different kinds of mental health issues. There are 3 main ways that mental health information in social media can be misleading and considered as misinformation. Firstly, much social media content is very short, 15 seconds, maybe a minute long. Misinformation can occur then in reductive descriptions of complex mental health issues. For example, giving a short list of signs that identify conditions that in fact take a very long time to assess with professionals. It can also occur in sensationalised or slang terms, as you see here in the example on the screen, antidepressant dupes, for example. Secondly, there's sometimes an overlap in the language that's used for normal emotional responses and that of diagnosed mental health conditions. This can lead to misleading ways of thinking about mental health issues, perhaps misrepresenting them in discussions and then shaping attitudes in unhelpful ways. So in our data, we saw this in all kinds of terms, misuse of words like anxiety or depression, trauma and OCD. Lastly, sometimes the solutions recommended as treatments for mental health and well-being lack evidence and can be completely inaccurate or partially inaccurate. So the example that you see here on the bottom of the screen comes from one of the influencers in our data set, recommending a supplement that treats depression through gene expression. That is the way that hormones are regulated, through taking a supplement that UK researchers recommend should not be used. So that's misinformation, but misinformation typically doesn't include stories about personal experience that people share about mental health issues. But these also require careful critical thinking, especially because of the very individual ways in which people experience their mental health. What's helpful for one person might be harmful for someone else. What's helpful at one part of a day might not be helpful at another time. We know from our research that young people preferred watching content from influencers who were like them. So understanding how to evaluate these stories of personal experience is really important. There are two types of stories that I want to raise your awareness of today. Firstly, recovery accounts, where someone is sharing their journey through a mental health issue. So that can include a whole range of different kinds of experiences, ranging from anxiety to eating disorders to post-traumatic stress disorders and more. Now, these stories can be really helpful. They can act as role models that offer hope and inspiration. But our young people told us that they could be triggering for them too, depending on the stage that a person was in terms of working through a particular mental health issue. A particularly controversial example is the videos that depict a person's experience as an inpatient, known in social media as a day in the life of a psych ward. On the one hand, these videos can be helpful as a balanced way of normalising professional support, but they can also contain distressing content or content that provokes unhelpful curiosity that leads the viewer to watch more content that's increasingly negative in nature. So as well as the kind of critical thinking that we need for misinformation that questions accuracy, we also need critical thinking about the emotional impact that viewing content might have on the person who's watching. Young people need media literacy that helps them evaluate the content that might be right for them right now. So just a heads up, we're coming to slide 7 now. So we've talked about misinformation, we've talked about media literacy and emotional response. But lastly, we need media literacy skills that really interrogate the impact of design that plays out in the social media sites that young people use. Now, I'm not sure how many of you watching use apps like TikTok yourself, but currently it's the third most used social media app in the UK, and its largest demographic is 18 to 24-year-olds. Most of the young people we talk to in our research use TikTok, often for fun, often to distract themselves in their downtime. And TikTok's design features encourage that kind of passive consumption rather than critical thinking. So the table that you can see on the right-hand side of the screen here shows you the different features that TikTok offers for its users over the age of 16 to engage with and to filter content, including safety features like turning off the sound, reporting problems and using a restricted mode so you can avoid unhelpful content. It's worth pointing out here that under the age of 16, many of these safety features are turned on automatically, but for over 16-year-olds, they're not. What you can also see here is the click count, so the number of steps that a person has to go through in order to activate these safety features, while how few they need to use in order to simply watch and scroll through what appears in their feed. And this kind of passive consumption, binge scrolling, speedy scrolling is often happening very quickly, leading to a lot of impulsiveness rather than having to weigh it all, as one of the young people in our research told us. In some cases, this then can also expose them to harm. For example, hearing content that might be triggering, even while trying to mark that content as not interested. By the way, and if you use TikTok, you may already know this, but in case you don't, actually to show that you're not interested in something and so not to see more of that content, it's not an intuitive action, but actually achieved through holding onto the video or using the share button. So we also need to help our students think critically about the design of the platforms that they use and what steps they might need to take to use them more safely. So what practical steps can we take to create conversations where young people can ask these critical questions? How do we help them to talk to each other in a classroom about these topics? We know that young people want to have these conversations and to evaluate what they consume and how they respond. The quote that's on the screen here is from one of the young people who took part in our project's youth jury earlier this year, where we asked young people from across the UK what solutions they thought would best address their needs about mental health and social media. They called for education providers to work with young people to develop learning resources that are conversational, relevant, engaging, and focus on how they consume as well as how they respond to the content out there. So that's what we have been trying to do, and we have created a game which we've called Scroll Smart. The resources that we've created are for young people, by young people. We started with the young people in our research team and our collaborators at the McPinn Foundation. We began with these young people's ideas that we tested initially with our Young People's Advisory Group, and we developed a prototype which we shared earlier this year at the National Literacy Trust Secondary Conference. If some of you were part of that testing, we're so grateful. Thank you for your feedback. Well, we listened to what the teachers' feedback told us. Then we took a refined version of the game to 3 different schools and colleges, where once again we've been testing and refining the resource. So the resource includes a card deck. It's a card playing game with scenario cards that are adapted from examples in our data, or which on the other side of the card have a fictionalized profile that illustrates the range of mental health content that young people might encounter. We want to take a balanced view, and we recognise that in the kinds of content that young people might experience, there is both helpful content and there's content that is really complicated to evaluate, and there's content that is actually quite clearly harmful. So we want to give young people the opportunity to be able to evaluate that as clearly harmful, helpful, and sometimes content that is just needing a bit of caution to evaluate. We're especially interested not just in the content, but in the people creating that content, because in the context of mental health, not every person who shares advice and information might be qualified to do so. There are a whole range of people giving advice, from people who are in professions that are regulated to different degrees, for example, psychiatrists, psychotherapists, nutritionists, dietitians, fitness influencers, life coaches. It's complicated to make sense of this terrain. So the card pack includes these cards that have the scenarios, it has a range of content creators, it has the voting tokens, and it has a range of prompt cards to get the conversation started. And these cards and their prompt questions bring together the critical thinking that young people need across 3 areas of mental health literacy. They go beyond a focus just on content to also think about the creators, and to think about the kind of actions that are being suggested for them, and to think about the designs of the sites that the young people are using. Now, these questions apply no matter what the platform on the technology. They work for TikTok, they work for other kinds of social media, and they work for generative AI. And crucially, they are designed as prompts to empower young people to have agency and take action in their consumption and in their responses to content. So, for example, the questions that involve thinking about what kinds of support they need or what somebody else might need, as you see in the top hand corner there, are quite broadly expressed, because that help might include starting a conversation with a friend. It might involve seeking professional help, whether that might be from a GP or from a 24/7 helpline like Shout UK. There are also questions that prompt young people to think about what actions they might want to take to filter and manage their own social media content, for example by setting time limits, going beyond the scroll and save practices with which we know they are familiar. Now, we want to make it as easy as possible for you to use these resources. We have created a suite of materials that include professionally produced videos by experts from our research team that can be played in no more than 2 to 3 minutes. They're on 3 key topics. Firstly, mental health literacy, 1 on misinformation, and 1 on influencers. We've also created step-by-step lesson plans, PowerPoint slides, the game and its instructions for play, a handbook and customizable templates, along with a worksheet version of the game. And all of this will be downloadable from our project website when it goes live at the end of January. And if you'd like a copy of the card deck, if you'd like a copy of the resources, all of which are free, we've got a form for you to express your interest at the end of the webinar so we can post this out to you and your school. Okay, so we recognise that technology also changes all the time, and that the issues that young people experience are also fast changing too. So in this last section, I'm going to give you some recommendations for resources and organisations that can help you stay up to date. First, there are a number of youth-led charities at the forefront of developing educational resources, including Spark UK, Young Minds, The Mix and the Anna Freud Centre. Following their pages on LinkedIn can help you stay abreast of the latest news, reports and resources. I'm going to know that I'm going through these quite quickly, but we're going to send the slides out to you after this webinar has finished. So please don't worry if you can't take a note of them all right now. Secondly, it's worth remembering that especially following the Online Safety Act, there are a number of changes that social media sites and tech companies have made, and they are often providing updates in their safety centres. So on this slide here, you'll find links to the big 3 sites used by teenagers: TikTok, YouTube and Snapchat. These companies are also on LinkedIn and you can follow them for their updates there. For example, just last week, TikTok announced a series of changes relating to their wellbeing resources and to their use of AI that will help make the site safer for those who are using it. There are also national groups campaigning and sharing news about online safety, such as Internet Matters and Shout Out UK. Again, the details are here on the slides. Lastly, the support that we provide needs to be sensitive to young people and their needs, and young people vary and schools vary. We know that from talking to young people, it's actually still really hard for them to talk to their peers without fear of judgment. Even coming to an in-person drop-in can feel really vulnerable to them. So practically, there are some steps that you can take that will help them. So if for example, if you're holding an assembly and you're talking about how they might gain support from you within schools, it can be really helpful to tell them exactly how to contact you. So do you want them to send you a Teams message? Do you want them to email you? Often that online contact can be really helpful to them, as taking that first step in person can sometimes be quite intimidating. Actually asking questions about mental health can be tricky too. So it can be useful to provide examples of ways to ask for help, maybe in the classroom or in offices, like those produced by Spark UK, which I've put here on the slide. And we know that many schools will have wellbeing officers and youth councils, and we'd be delighted for them to adapt and update our resources so that you can tailor them for the schools where you're based, or use them as inspiration for an initiative of your own. Alright, so I hope that you found the content that I have just covered useful. Our colleagues at the National Literacy Trust will send you a copy of the recording and the slides after the webinar so that you can revisit this for your own learning, or feel free to share it in a development session in your own school and college if you find that useful. We'd also love to send you a copy of our card deck and the resources that we prepared. We'd also love to invite you to the final event that we have in our research project, which is a showcase based at the University of Birmingham, where we'll be sharing stories from young people, meeting some of the influencers who've worked with us, and learning how to create stories about mental health with the spoken word artist Polar Bear. We have 60 places that we're offering free to schools, so if you'd like to take part and bring some of the young people from your schools, please do give us the details in the form that's linked through this slide, and we'll be in touch with you for more details about how you can book a place. Now, I know that life is really busy and there's been a lot to take in already this evening. So the form that I've set up here also gives you space just to reflect for a moment and to think about one step that you can take forward to put this learning into practice. I really hope the webinar will actually give you something really concrete, something practical that you can do that will make a difference both to you and to the young people that you work with. And we're going to leave this form open for the next couple of weeks. So if you want to fill it in later, if you haven't got time right now, then that's absolutely fine too. I am just going to pause for a moment. That will give you a chance just to get your phones out and to open up the QR code, or to use the link that is in the chat so that you can open up that form now. So fingers crossed the form has worked for you. I want to thank you again for joining us at this session. Thank you again for all the work that you're doing with young people wherever you're working. And we hope very much that you have a lovely rest of your evening. Goodbye.